Hello, this is Dr. Gay from First Look MRI, and this is a 40-year-old female with complaints of knee pain for about 2 months. Pain was worse on the left side. The orthopedic office did some x-rays and they're right as normal. This is an AP view of the right knee looking straight on. We see the medial side of the femur, lateral side of the femur. This is the tibia down below the knee. Here's the fibula, the small bone. This is the kneecap over here. Here's the left side. If we put up a side view or a lateral view, we see the femur here, the kneecap from the side, and profile is the tibia and fibula again to get oriented. Now we'll put up the MRI because the patient had pain. It was unexplained by the x-rays. And we see that the patient does have some abnormality here. This is the femur again coming down. We see these broad areas of serpiginous low signal, sharply defined margins in the lateral femoral condyle and medial femoral condyle. This is classic for avascular necrosis. Also here in the tibial spine. Now in retrospect, if we go back to the the x-ray of the left knee here, it is a little bit of increased density here. That is the AVN, but it's just so easy to jog past. And over here too, maybe a little bit of increased density. On the opposite side, similar density. If we put on the side view here, you really can't see it at all. But here we go back to the MRI scan. We have the what we call a coronal view. It looks like the AP view of the x-ray. And this is called a T1 image where fat is bright. You can see subcutaneous fat is bright. Marrow is bright, that's normal. And the area that is abnormal is the area that is dark with these sharply defined margins like you draw out with a pin. This is a side view. We call this a sagittal image where we see the kneecap here. And here is the avascular necrosis hugging the femoral condyle. This patient also had a tear of the meniscus. This is the medial meniscus. This is the front, the dark little triangle. This is the back of the medial meniscus, and they should look like a mirror image. Nice jet black triangle in the front, nice jet black triangle in the back, but if we go to this image, you see that triangle looks irregular, and here we don't see it at all. So a complex tear back here in the posterior horn of the medial meniscus in this patient with AVN or avascular necrosis. Now here's another view to look at this. This is a different sequence where fat is suppressed, and this really jumps out even more. The area of abnormal signal now is bright on the background of dark marrow. And this is that tear of the meniscus. That little bright spot there is where the meniscus is torn. And this patient, we don't know why she has AVN, but patients with AVN can get that from prior injury where they have a fracture and injury to the blood vessels. People who have long-term steroid use or long-term alcohol abuse or sickle cell disease, again, sickle cell disease or other blood disorders. Patients with chemotherapy or radiation therapy where there's injury of the blood vessels can cause that as well. People with pancreatitis are more prone to get avascular necrosis and several other things. But this is a patient with avascular necrosis of the left knee here. And again, in retrospect on x-rays, it looks like the patient probably does have AVN of the opposite side because both sides have increased density of the condyles. And that's it. Thank you very much.